So what is this interprofessional education? So this interprofessional learning, it occurs when two or more professions learn about from and with each other to enable effective collaboration and improve health outcomes, which is abbreviated as WHO 2010 established. Okay, so coming back to my week one. So what did we actually do? Week one is nothing much, where the lecturer, they did an introduction to IPE and they had some ice-breaking sessions and also discussion on how the IPE is basically going to be conducted. So that's what we did. So what is this interprofessional education? So this interprofessional learning is two. So for week two, we learned about characteristics of good teamwork. So what did we actually do? Video presentation or a video review, where we did the video which contains 4 different scenarios in a health clinic setting, where each subgroup is tasked to discuss on one scenario only. So for my scenario, we were given the Emily Lee receptionist, where there's a scenario where the worker will call the receptionist and inform that she is absent on that day. So this Emily, the receptionist, will inform the chief doctor that she is absent. So the chief doctor will conduct and distribute the tasks equally to the healthcare professionals in order to prevent any misleading of information and also misleading of work, making sure patients are not left behind and they were given proper treatment. So this shows proper teamwork skills and backing up each other when one is not there. And video presentation or a video review. The chief doctor, he lead everyone as a team, making sure there was no mistakes and everybody did their work efficiently. So this is the chief. So for week 3, roles and responsibilities, we discussed a role play where it reflects the roles and responsibility and scope of practice of one's own profession and of other healthcare professionals. So what do we actually do? It's basically a role play where there were several scenes we created. So our group, we created a road accident scene where the patient would get into a bike accident and the paramedics will be involved, and then nurses will be involved, interns or housemaids will be involved, chief doctors, and also the radiologists will be involved. So this, as you guys can see in this picture, I'm explaining to the patient what happened to her and her results, because the radiologist misdiagnosed role, explaining yourself that you did your wrongdoing to the patient in order, like you're apologizing to the patient, like, I'm so sorry, we did this wrong misdiagnosing, and also the x-ray on your left leg where it's supposed to be on your right leg. So the patient understood professionally and we redid the scan and then re-explained to her and provided her with proper care. So in this role play, we portrayed each one of the nurse's role, the paramedic's role, the doctor's role, houseman's role, and I played the houseman, where I have to check the results and also explain it to the doctor. So the doctor corrected me. So this is how interprofessionally we were linked and also worked in order to come to the final outcome. So for week 4, we did communication with others, where it's basically a debate where each subgroup has to communicate each other to defend their points, where we were given several questions regarding the pandemic, like online learning, how do you find it? Like, is it okay? What's the benefits? How do you find it physical and online? Is it hard for you? And everything, how is the transition and everything? So for one of the question, I did it, which is, do you enjoy learning virtually? So yes and no. Yes, in the sense, because I get to save my time and energy from traveling, which saves fuel and toll expenses. On the other hand, I can also eat home cooked food rather than spending pennies on outside food. Like, you understand what I mean, right? So, and also I get to study in my own study space comfortably with zero distractions. Because if we were to go to campus and everything, there will be a lot of noise distractions and everything. So if we are in our own place, we will be comfortable. Okay. One of my team member went to the debate and they discussed professionally regarding this online learning. So it was like a interactive debate, saying that there was pros and cons on learning, and also they were open to opinions and also sharing information. So this just portrays good communication with each other, understanding and receiving opinions. You have to be open-minded and not very close-minded to understand what's their perspective. You have to accept that even you like it or not, which will widen and also sharpen your thinking as well, because you're not always right. Am I right? So for week 5, we did general teamwork skills. So what is that we did? So for general teamwork skills, we had to discuss a case study where all students should read a newspaper article and discuss regarding all the issues related to hospital or interprofessional career. So we chose a case study regarding the 20 years of Jharkhand patients that National Consumer Court finds medical negligence by Ranchi doctors, basically to address a point where identify the good characteristics of each team member that gives a good outcome to the whole team. Where in this setting, there was two characters where they are higher authority doctors who gave their opinion on this medical negligence, saying it's wrong, and made sure that the doctor who did this case and did the wrongdoing received his punishment. So this is professionalism and ethics, where obtaining advice and opinions from experts in determining and expanding the viewpoint of medical misconduct. So like professionalism in the sense of addressing the negligence despite the consequences of the doctors in Ranchi, such as Dr. Mohan, the attending doctor whom involved in the misconduct, to obtain proper sentencing from the court. So in the sense of ethics were followed and implemented in the sense where under the law of negligence, stating in a breach of the study of care owned by a healthcare professional to their patient, resulting in harm or injury, which completes the legal course of action. And last but not least is for week 6, where we did our major project, which last week ago, where we produced this poster. So basically, it is a poster regarding this teamwork awareness campaign, where we had to introduce the awareness campaign for professional education. So I talked about the benefits of this IPE, which is variation in the sense of perspective and also characteristics. You perspective, for example, if you're doing a surgery, okay, you think that this treatment is the best, but then a nurse, you might think, oh, how come a nurse has a better knowledge than me because I'm a doctor or something like that? But then nurse can give out a better opinion that you can't think. You will maybe think like number 10, but she will think number 1, the most basic idea, which might be the most effective treatment for the patient. So lastly, I would just like to conclude this IPE. I learned a lot about teamwork skills, where it really sharpened my teamwork skills in order to work in a different group settings, adapt to different type of characters. I have to be in different type of situations and arrange my timing and also accept the behaviors and also opinions of others. So it did really broaden my perception on teamwork, and it really helped me as a person and also sharpen and molded me into a better person where I can work as a unit now, and it really, really did help me to grow as a person. Thank you, everyone.